Welcome to today's explainer. If you've ever felt totally overwhelmed, confused, or just plain frustrated by your menstrual cycle, I want you to know right off the bat that you are absolutely not alone in this. Today, we're walking through a really supportive, comprehensive guide on irregular periods and how they actually affect your fertility. We're drawing all our insights directly from the expert resources over at Fertility Clinics, basically translating their medical expertise into a clear, easy-to-follow roadmap just for you. My goal today is to give you some clarity, some comfort, and an understanding you can actually act on.
Okay, let's dive into this. Is my cycle just acting up, or is it a red flag for my fertility? I mean, that is the exact stressful internal anxiety so many women carry around every single month. Your period gets totally unpredictable with its timing, the flow is way off, or the pain is just worse than usual. It's incredibly stressful wondering if this is just a minor hiccup or a warning sign about your long-term reproductive health. So today, we are going to unpack that exact question together and get you the answers you deserve. Section 1. Defining the baseline. To figure out what's irregular, we really need to know what normal looks like. A normal menstrual cycle generally falls somewhere in the range of 21 to 35 days, bringing with it a pretty predictable flow each month. On the flip side, an irregular cycle is one that completely breaks that pattern. We're talking shorter than 21 days, longer than 35 days, or just totally chaotic, like skipping entire months or shifting erratically between very heavy and very light bleeding. Now, you might hear doctors throw around some heavy-sounding clinical terms, and I want to de-jargonize those right now so they aren't so intimidating. First up is amenorrhea. This is literally just the medical term for missing your periods for months at a time. It sounds like a really scary word, I know, but missing periods is actually a widely recognized condition. And more importantly, it has clear, straightforward management paths. It's a signal from your body, not some unsolvable mystery. The second term you should know is dysmenorrhea. Basically, this means severe pain and cramping during your cycle. And look, I really want to validate this for anyone watching. Severe period pain is not just some standard annoyance you have to grit your teeth and suffer through. If it is disrupting your daily life, it is a specific symptom of menstrual irregularity that absolutely deserves proper medical attention. Section 2. Causes and triggers. Now, what's really interesting about this is how these irregularities stem from a massive, complex web in our overall health. They don't just come from one place. It's like a giant puzzle. You've got hormonal imbalances like PCOS or thyroid issues, underlying medical conditions like fibroids or endometriosis, and even natural age-related shifts. But, and this is huge, they also stem from lifestyle factors. We're talking extreme diets, weight fluctuations, super intense exercise, and stress. Both your physical conditions and your daily lifestyle choices really intertwined to dictate the rhythm of your cycle. Which brings us to a super specific yet incredibly common patient concern pulled straight from the Fertility Clinics FAQ. Why is my period so irregular after age 40? Honestly, so many women notice sudden dramatic changes as they hit their late 30s and 40s, and man, it can trigger a ton of immediate anxiety. So here's the deal. Irregularity after age 40 is typically just the first sign of perimenopause. It's a completely natural hormonal shift. As your ovarian activity and egg reserves naturally start to wind down with age, your estrogen and progesterone levels bounce around, which causes those shorter, longer, or skip cycles. But I really want to emphasize this point. While declining egg quality definitely makes conception a bit more challenging during this time, pregnancy is absolutely still possible, so don't count yourself out. And there is a powerful connection to consider here too. Quote, you produce more cortisol when you're in a constant state of stress, which also could disrupt progesterone and estrogen levels. Let that sink in. Emotional and physical stress directly impacts whether or not you even ovulate. Your mental health and your reproductive health, they are deeply biologically linked. If you are incredibly stressed out, your body essentially hits the pause button on reproduction because it doesn't think it's a safe time to sustain a pregnancy. Section 3. The impact on fertility. We are going to tackle this fear-inducing question head-on, because honestly, it's the very first thought that pops into a patient's internal monologue when they skip a month or two. Does an irregular period mean infertility? Well, the answer is a very reassuring, not necessarily. However, an irregular period is a strong indicator of ovulatory dysfunction. That just means the delicate process of releasing an egg is getting jammed up. It complicates things because you might not be releasing an egg at all, a condition called anovulation, and it makes tracking your fertile window incredibly difficult. But hear this. so many women with irregular cycles absolutely still conceive. They often just need a little bit of medical guidance to get those hormones back on track. Now let's flip the scenario for a second to tackle a massive misconception. This is another really vital insight from the clinic's data. Can a woman be infertile and still have totally regular periods? Crazy as it sounds, yes, she can. As the clinic puts it, quote, while a consistent cycle often indicates ovulation, it does not guarantee that the eggs are healthy or that the reproductive tract is clear. A perfect, normal-seeming 28-day cycle usually means you're ovulating, sure, but it does not rule out hidden issues like blocked fallopian tubes, endometriosis, or poor egg quality. And that's exactly why a specialist evaluation is so critical. You simply can't judge the full picture of your reproductive health just by looking at the calendar. And actually, let's pause here for a second, because this is so important. Treating these irregularities is about your overall well-being. It is not just about having a baby. Irregular periods take a massive physical and emotional toll. Extremely heavy bleeding, or menorrhagia, can lead to chronic fatigue and anemia. The constant unpredictability brings persistent bloating, stress, and serious anxiety. Your everyday comfort and daily health matter just as much as your fertility. Section 4. Natural Management Options. The good news is, a lot of cycle management starts right at home by naturally stabilizing your endocrine system. We're talking the basics here. Maintaining a nutrient-dense diet packed with whole grains and iron, which is rapidly depleted during those heavy periods. Exercising regularly to help control hormone levels and your weight. Actively practicing stress management like yoga or deep breathing to wrangle that cycle-disrupting cortisol. Oh, and never underestimate the sheer power of a solid night's sleep to keep your body's natural rhythms running smoothly. Section 5. When to seek medical help. So the crucial point is knowing exactly what your red flags are. It is absolutely time to book an appointment if your cycles are consistently shorter than 21 days or consistently longer than 35 days, or if you skip 3 consecutive months, or if you're dealing with extremely heavy flow or severe pelvic pain. And hey, if you've been actively trying to conceive for a year without success, or just 6 months if you're over 35, that is a clear, undeniable signal to go get some professional testing. Let's move to and see how this builds into a very clear, actionable, and totally calming roadmap for you. Step 1, start tracking your cycle closely today so you have actual data to show a doctor. Step 2, take charge of those lifestyle and stress factors we just talked about. And step 3, do not hesitate to schedule those checkups and fertility tests to rule out any underlying conditions. It's just a simple, structured path forward. And when you do reach out for help, please remember that expert clinical intervention isn't something to fear. It's a highly supportive, personalized tool designed for your peace of mind. Clinics like ART Fertility Clinics in the UAE offer advanced, personalized care that addresses the actual root causes of this stuff. Whether it's hormone management, fertility planning, or just lifestyle optimization, they are ultimately guiding your body safely back to balance. So, I'll leave you with this. Are you ready to take the next step toward healthier cycles and long-term peace of mind? Your period isn't just some monthly inconvenience. It's a vital sign. It's your body communicating with you every single month. So, are you finally ready to listen to what it's saying? Thank you so much for joining me for this explainer. Keep learning, stay empowered, and please prioritize your health.